everyone. My name is Jessica. I'm here with Evelyn.
Hi,
How you doing,
good
Evelyn?
and you? How you doing?
I'm doing good. I'm really excited that we're gonna start a new topic.
Yes, I'm excited. This is so good. What are we gonna talk about today?
We're gonna talk about the big ACA,
Yay!
Affordable Care Act.
Yes,
Or how people call it, Obamacare,
Obamacare,
right?
exactly. Or marketplace.
Or marketplace, yeah. It has few names, so that's good.
But it's the same thing.
It's the same thing.
People look at it in different ways, but this is a new topic. We finished our series in Medicare. If you guys are interested, you can go back to look at our videos to see what we talk about on Medicare. If you guys have any questions, please don't hesitate to let us know. Put questions in the comments. That's perfectly for us.
Yeah.
But this time it's all about Obamacare, ACA.
So before 2010, millions of Americans have no health insurance. How?
Yes.
Many were denied coverage for pre-existing conditions like asthma, diabetes, or cancer.
Exactly.
So
meanwhile, healthcare costs were rising every single year, including hospital costs, prescription costs, and doctors' visits became more expensive, and working families couldn't afford insurance.
Okay, so several presidents tried to fix the system, Evelyn.
Yes.
But wasn't until March 23, 2010, when President Barack Obama signed the Affordable Care Act into a law.
Exactly. And that's a good thing because that's how ACA or Obamacare was born. The marketplace is more accessible, fair, and affordable for everyone. That means that a lot of people after that were able to get health insurance.
Yeah. Okay. Sorry. So the ACA was designated around three main goals. So the first goal was make insurance more affordable, tax credit, and subsidize. So the second one is spend Medicaid to cover more low-income adults. So because remember, guys, Medicaid is a law that we do have based on income. So it's really tight because different states they do have different
sharp brackets.
So then with the Obamacare, that was an extension for those people to get, the people that doesn't qualify for Medicaid, but they still on that chart of poverty, they can get insurance. So that was something that it targeted. And then the third thing that it targeted, it was the protect consumers from unfair insurance practices. That's amazing, right?
Exactly. And because of all of that and all these policies that came in back in 2010, insurance company cannot deny coverage due to pre-existing condition, young adults that are still staying and living with their parents that are under the age of 26 years old, and preventive care is covered at no cost. So this is the beauty of it, that this insurance came into place, because a lot of kids that are still living at home with their parents that are under 26 years old, they can still get health insurance coverage. And that's a good thing for a lot of our teenagers nowadays, our young adults.
Definitely. Yeah, it's an opportunity for them, to just don't stress out, hey, I don't have insurance because I'm still in school. And I don't have a full-time job that it give me insurance.
Yes.
And then they can be covered to their parents. So that's great, So here are some of the most important benefits that ACS still provide today. So
exactly. So that is, like we said a few seconds ago, the pre-existing condition. Marketplace plans cover essential benefits like hospital care, maternity, that is very important, mental health, that is extremely important nowadays with how things are in society, prescriptions, and preventive care. The premium tax credit helps reduce your monthly cost. Preventive checkups like a mammogram and screenings are free. Remember, when you do your preventive care visits once a year, those checkups are extremely free. And that's a good thing because a lot of people don't think, oh, I have to go get a mammogram, or I gotta get a pap smear, or I gotta get a colonoscopy. Those are preventive care.
Yeah.
And those are actually free. That's your first visit that you do is free.
Yeah.
And also another thing, remember that we just talk about it, are young kids that are 26 years and younger. They can still be in the plans with their parents.
Yeah, that's good. It's just all good things that they thought about everything. And if you see, like you were saying, everything about the preventive checkups, most people, they think these things they have to pay for it.
Exactly.
And they don't do it because they say, you know what, I want to check myself, but I don't have the money, to go and pay maybe $100 to do it. So we want to just let you guys know that this is in your insurance, and they are preventive, and they are free.
Yes.
So you can do that
Exactly.
without being like charged for anything, and then you have that peace of mind. At the same time, it's like a way you to thank the government, and then you help and then the system that, hey, I'm being preventive with my health, so that way I don't have a huge bill because I didn't attend it on
Exactly.
time. So that's, I think, a good thing to do. So thanks to those protections, millions of Americans who were once unsure, now they have quality coverage, and that's
really good. That's amazing.
That's really good.
So how the marketplace works. So the ACA created a health market insurance, also known as healthcare.gov, healthcare.gov. That's where people can compare plans and apply for financial help. Okay, so that's where you guys go if you don't have an agent like us,
Exactly.
that we are able to help you guys with what is the best benefit and the best coverage for you guys. You guys can go in there, see what you guys qualify for, and if you guys have questions, please don't hesitate to let us know. This is where we come in.
Exactly. We are here to assist you. We are at the distance of a phone call, text message, DM, and you can just let us know, and we're here to assist you. Don't think that you go there and it's too overwhelming, because it's a lot of information. I'm gonna lie to you guys. And it's a lot of information that maybe you understand some things but other no. So don't stay with questions, or don't pick even an insurance that you don't even understand. So because we are here and we don't charge for this,
Exactly.
Right?
Yeah. So please don't forget, make sure you get with a licensed agent. Like Jessica said, we do not charge. This is a free consultation, you guys. Don't, anyone that says, oh, we're going to charge you for checking your health insurance. No, that is a lie. There's no charge at all. Okay. This is totally free. Free consultation. We check your plans. We check your benefits, making sure that you get the right benefit that fits your needs.
Exactly. Because it's like you plan, we can go through it. We can let you know what you even have right now, and then what is the difference between the new plans and which one would be. You're the one that's gonna make the decision. We're just gonna like basically break it down for you,
Exactly,
so you can understand it, right,
yes,
Evelyn? Yeah. So each year during the open enrollment, individuals and family can renew or switch their plan. So,
exactly.
Even after more than a decade, so it's been like 16 years, to be honest, that we had the ACA.
Oh my gosh, yes.
Keep evolving, my people. Like, this is changing. So in 2026, it doesn't gonna be any different. So it brings some big changes that everyone need to be aware of. This is important,
Yes,
Evelyn, right?
Exactly. Insurance companies are proposing an average increment of 18% premium increase for 2026. Marketplace plans, mainly due to rising costs of your prescriptions and inflation. So just keep in mind that everything's going up. So your health insurance with the marketplace is going to go up.
Exactly. So that's why it's crucial they review the plan carefully during open enrollment. What the cost is $0 today, might next year it won't be like that.
Exactly. It's going to be something totally different. So that's why we're here to help you guys. Now, keep in mind that the enhanced subsidy introduced during the pandemic are set to expire at the end of December of 2025, unless the Congress act to extend them. You guys know that the government right now is shut down, and part of that is because of what's happening with our healthcare. Okay, so there are many changes happening. Well, I'm hoping that they will reopen soon, so that then the Congress can come together and just extend this part of the pandemic, because that's going to still help people out there.
Yeah, so basically, like before the pandemic happened, the credits and the subsidy that we have, it was less, but because COVID came, and everything happened, they added more, more money for people to have better coverage, because we needed the health insurance. So with that being said, that can change, like Evelyn said. If they don't sign that law extending, you guys gonna see a difference in your policies, that you're gonna see a less credit than what you have right now.
Yes.
And you have to be aware of this, right, Evelyn?
Exactly.
They have to. So they might expire, and many families will there see the financial help reduce, and every month, the monthly, it could be a premium, or it could be double, or it could be increased up to 75%. That is a lot. So we want just you guys to know this, because it's coming, if that not change with the Congress decision.
Yes, and another new rule that's going to happen for 2026 that is very important for everyone. The new federal rules, the marketplace integrity and affordability fines rules will enforce strictly income and eligibility verification. That means that you guys have 60-day period to submit eligibility of your income and eligibility of your income.
So basically, any documents that when you guys do the application, if you didn't put your ID, if you have a social security and it's needed, if you need your income and you say, hey, this is how much I made, they gonna need proof. So it's not gonna be now like before. In the past, it was people that it was saying, hey, I made $25,000 a year, or I may make 30, but I don't know. And then it was put that or less. Now it's not going to be like that.
Exactly.
You have to have proof of your income. If you say you're gonna make $20,000, you need to prove your paycheck or your income that you're making that. If those ain't gonna be this, you guys need to notify the marketplace, because you don't gonna like at the end of the year when your income tax said that you made $35,000 or $40,000, and you lose your credit and you need to pay the money back.
Exactly.
Because as people gonna pay, the people that have less credit than what they deserve, they will get that credit adjustment back. But the people that got more credit than what they really said they were supposed to getting, you have to pay that money back. So you need to be really aware of this.
Yes, these are the changes for 2026. Please keep in mind that verification is very important. If for any reason you guys do not submit income changes, you will have to pay that subsidy back when you file taxes at the end of the year.
Yep.
So that's like a penalty that we get when you guys don't, well, that you guys get when you guys don't show your income correctly.
Yeah, we need to be transparent. Like basically now it doesn't gonna be like before. Oh yeah, I'm maybe gonna make this amount of money, but then you don't have to show the proof. Now they have to. If you have an insurance and you didn't show your proof, guess what? In 60 days, your insurance is gonna be just shut down. No insurance for you.
Exactly.
So starting in 2026, there will be no cap on how much you might be to repay if you receive more subsidy than you actually incomes allow you. So that's if you receive more.
Exactly. And like I said before, make sure you guys submit your income, because if not, you will have to pay that back and you'll use that subsidy, when you do
Yeah,
your taxes.
yeah. For the 2026, the max out of pocket maximum cost on the is gonna increase too.
Yes.
So be aware of that, guys, because for individual coverage, the max out of pocket is gonna be $10,600 if you are a lone person in the marketplace with your insurance. If you have a family coverage, then it will be $21,200.
Exactly. So even if your premium doesn't change much, your deductible and the cost sharing may change some. So reviewing your plan and going over the essentials, like if my out of pocket is going to change, if my deductible is going to change, my premium is going to change. That's when we come in, you guys. It might change a little bit, but please make sure that you get your policy review by a licensed agent. Don't wait until the last minute and then you won't have no coverage at all.
Exactly. Or you will have been enrolled automatically in a coverage that you're going to be paying
Exactly.
more than what you even do it. So do remember, I always said this to everything, and it applies in everything in life, Evelyn. Even not making a decision is making a decision.
Exactly.
So when you say yes, no, or maybe, you're still making a decision, because you are, even if you don't say nothing, you're doing something.
Exactly.
So it's better to have that power and just make the decision on yourself, with a knowledge, what is available for you, what you have.
Example, Jessica, let's give them an example. So for this year right now, you are paying zero premium. You're not paying nothing. But next year, you will have to pay $5, $10, $15, or $20 a month.
Exactly.
Okay. Also, what's going to increase is going to be your deductible and your out of pocket.
Exactly.
Okay, so let's keep that in mind. These are changes that are happening right now with the Congress, with the plans for the Obamacare marketplace. They're all the same. It's the same thing. It's just different names. But just keep in mind, those are the changes that are coming this year.
And they're really important that you guys know, and that's what we're here telling you. So if you enhance a subside expire, the 400% federal poverty level cap will return. So a many middle class family could lose their financial help.
Exactly, Jessica. That's why it's crucial to work with a trusted agent who can calculate your income correctly and maximize your benefits. And that's where we come in, so we can help you guys. We just have to see, your income for next year. What have changed? Do you have a family member added to your family? A child was born. Those are all the changes that come into place. If for any reason you are working full-time and now you're working part-time, those changes are very important. We have to report those changes so we can calculate and do what we need to do to get you the best coverage that you need.
Exactly. Because important, remember, your best health is today, and it's important that you be covered, And then, as you can see, the ACA continues to evolve, and is 2026 will bring significant changes, could affect your coverage and your costs. So it's important, guys, that you know these changes, okay?
Exactly. So don't wait until the last minute, you guys. Let's get ready for open enrollment that is right around the corner. Open enrollment start November 1st to January 15th of 2026. So please don't forget, we are here to help you guys. Don't wait until the last minute. We have to submit all those documentations in time. Make sure that we all set up, that you guys are set up with the plan that you guys need, so you guys can have coverage for 2026.
Exactly. So if you need help again reviewing these plans that you have today, or you need to apply for new covers, we are here to help you. Remember that if you are a person that doesn't have documentation, or your in immigration process, or you are not really legal in the country, don't worry, because we do have options for you guys too. It doesn't gonna be in the ACA platform, but we do have options, because we believe that everybody deserves to have coverage for their health. And the companies, the private companies as well, they do believe that. So that's why they have options for you guys. So don't be afraid. We are a safe place here to talk to us, and that's what we're doing, what we do, because we really love to help people.
Yes, we are here to help you guys. That's going to be on our next video. We're going to talk about the private insurance and how we can help you guys that know anyone that doesn't have their papers yet, are in documents, so we are here to help you. There's help for everyone, so don't forget that we are here to help you guys as much as we can. Whatever needs you guys may have, we are here to provide the service that you guys need for you guys. And don't forget to click, share, comment, and subscribe to our videos. We are here to help you with any health insurance questions that you guys may have, or any financial planning. So Jessica and I are here. Follow us. We're going to leave our link below. So if you guys need to make an appointment directly with any of us, we are here to help you guys. Remember, you guys, we are here for you guys.
Exactly. We are here to assist you, to help you, to educate you. And no question is a bad question.
Exactly.
Please. So ask the questions you have, because, whatever question you have, if we have the answer, we give it to you. If we don't have it, we have homework.
Exactly.
It's okay. So please like the video, share with your family members that maybe they new in town, or they moved from another country, or you don't know if they have insurance or they qualify. So that's what we're here to for you.
So see you guys on our next video. Stay tuned. We're here for you guys.
Bye.